A group of Army reservists from southern Colorado is back after treating COVID-19 patients in one of the hardest hit regions, the Texas-Mexico border. KRDO News Channel 13's Alexis Dominguez is live in Colorado Springs to tell us what they saw on the front lines. Alexis?
Lauren, today is the first day back for those nurses who deployed to Texas in late August. Today, I got the opportunity to speak with them about the sadness and triumph they've witnessed over the past few weeks. This group has been together in the fight against COVID for over 3 weeks. The mission, to help overburdened doctors and nurses. It hasn't been easy. They themselves have had to make sacrifices. Lieutenant Tina Simpson moved up her wedding to serve as a medical surgical nurse.
Most of my career is emergency room nursing, and so that's where I fell in. There was about 6 nurses that we all took over our role as a team approach in the emergency room.
Sometimes treating many patients at a time.
Working by yourself with 4 sick patients is not always easy, so we started implementing in the Army side a team approach.
She worked alongside Major Kim Whitaker, a nurse practitioner who says she saw death firsthand many times.
Unfortunately, there was a lot of end-of-life discussions that we had to discuss, so my role was to help the nurses and the families understand how we could relieve pain and suffering.
Captain Eric Wilkins, a psychiatric nurse, says this kind of work can bring on a silent enemy.
There was a lot of stress, a lot of depression, a lot of just confusion, not knowing how to deal with life at that moment. I had several staff members that I referred to their behavioral health team at their hospital because of suicidal ideations.
His job was helping crews deal with the emotional and mental burden.
They're at just getting by a lot of times. They have so many things going on at that point that they're trying to just get to the next day.
While this job wasn't easy, they say it was at times extremely rewarding.
There were a few patients that were ill who were able to recover and to be discharged.
Now, because these nurses were directly on the front lines of fighting COVID-19 and were potentially exposed, they were held in isolation before coming back home and being with their families. Reporting live from Colorado Springs, Alexis Dominguez, KRDO News Channel 13.